My name is Kinsey Ruhl. I attend Southwest Baptist University, and today I want to discuss how educating asthmatic children on the importance of medication adherence and how an age-appropriate resources are important to any patient. For my introduction, I would like to start by telling you why this topic is important to me. This topic is important to me because my younger brother has asthma, and it affects him in his day-to-day lifestyle. Sports for him has always been difficult, and he's had a hard time keeping up with his medication regimen as he grows older. Frequently, during school, he would get asthma attacks. And when we attended the same school, it was easy for me to help him, remind him about his medication. But now that I'm in college, it's been a lot more difficult for him to adhere to a specific medication regimen. This topic is important to the public because 300 million individuals are affected by asthma worldwide. A majority of these individuals are children, just like my brother, who suffer from troubling symptoms that negatively impact a person's quality of life. Sports, going to school every day, if you have severe enough symptoms, day-to-day living can be troublesome. As a result from asthma and asthma attacks, 250,000 deaths can on average occur per year. This topic is important to healthcare system because teaching and educating patients is a huge part of the healthcare system and is also our best preventative medicine that is widely underutilized. Because all well-educated patients can avoid incidents such as an asthma attack. And this way better helps them prevent situations that can be troublesome. This information is important to patients and subjects because being educated about a personal diagnosis is the best way to improve one's quality of life and lower symptoms and incidents that can possibly occur or lead to death. For my PICOT statement, I wrote out, for children diagnosed with asthma, does educating and teaching strategical, helpful ways to adhere to their medication regimen compared to no education or teaching improve quality of life and lessen frequency of asthmatic episodes? In this PICOT statement, I did not include a time frame because the assignment does not call for it. But in a usual normal review of studies, the study has a time frame. So my description of research for these articles. I started with electronic resources like the Cochrane Library and national guidelines. I did not find any articles that I felt helped me with this assignment. So I went to Southwest Baptist University's library databases, and I found all 5 of my articles there. My search terms, by using the search terms and the Boolean operators, I chose asthma in children and asthma's management and education. These results, I have 104 listings to go through. Then I went and narrowed my search. I narrowed my search terms by limiting to a full text. That way I had the full research study. My publication only dates back to 2007 to keep up on current studies and nothing too old. I only allowed academic journals because I didn't want any personal opinionated articles. And then I also narrowed my search to the age group of 6 to 12 years old because I wanted school-age children to see if we had age-appropriate resources for them on asthma. Also, I narrowed my search to English language only because I don't know how to interpret any other language. My 5 articles of study were produced including many different levels of evidence, such as a level 2 randomized controlled trial, a level 3 quasi-experimental design, and a level 5 questionnaire. I feel like with so many different types of level of evidence, I could use a little bit of each trial and design and add it to my PowerPoint. These articles are chosen based upon their level of evidence, their purpose that they explained in their introduction, and the relativity towards my PCOT statement. To discuss my findings, I found a lot of similarities between my 5 articles. Teaching and educating asthmatic children would help with medication adherence and decrease asthma attacks. More age-appropriate resources are needed about asthmatic care for school-aged children, and improving adherence improves children's quality of life. Some inconsistencies I found with these 5 articles are about how much the caregiver or teacher involvement should children have with their medication adherence. This was an inconsistency. Some articles believe that at a certain age, children should be able to take their medication on their own. Other articles that I found suggest that more caregiver and teacher involvement is needed for the medication regimen to be adhered. Also, individualized opportunities for self-management plans directed towards asthmatic children and their caregivers were inconsistent across my 5 articles. Some gaps that I found include the studies about extracurricular activities and the effects they have on asthma. Like I told you earlier, my brother has always had difficulty playing sports growing up, and I know that he always had trouble, and many other kids his age also had trouble with their asthma. So doing a study about that and how extracurricular activities and asthmatic students play them would be a great step further with this research. Familial interventions that lead to successful asthma management to improve quality of life was also another gap I found. And also, a lot of the sample sizes that were studied were small. Bigger sample sizes for future studies would help with the results of the studies. Some limitations, like I said, was sample size, and also a small amount of age-appropriate researchers worldwide was also a big limitation for the research. In summary, these 5 articles suggest in some part or another that having age-appropriate resources for children about their asthma diagnosis. These children can be educated and taught strategical, helpful ways to adhere to their medication regimen and can improve their quality of life and lessen frequencies of asthma attacks. These findings all suggest in some way better education can improve the quality of life and lessen the frequency of asthma attacks in children when given age-appropriate resources about their diagnosis. I feel that teaching patients, even if they're of, age 12, that they adhere better to their medication and they also understand more what's going on with their body and how to prevent things like asthma attacks better than if it was just their parents or their teachers guiding them along the way. In conclusion, I feel there's evidence to support practice change because of not just the information in these articles, but because of the precedents set forth. In healthcare field, healthcare professionals have evidence suggesting that teaching can be a great tool to educate patients, and that education can lead to prevention of any kind of symptoms or side effects. I did not find a guideline. Like I told you, my electronic resources, I did not find an article that I liked enough to use for my research project. But there is evidence to support a change in practice, or at least enough to question the current practice that healthcare providers are using nowadays. Especially if more studies are done to further the research, we can do a great deal to help children and how they deal with their asthma. Thank you for listening to my project and looking at my PowerPoint.